Hello everyone, myself Pankaj. Welcome to Being Fishco. In today's video, we will talk about MCQ related to fish and shrimp health management, which will be very much efficient for your ICAR, JRF, SRF as well as fishery related other competitive exam. Before starting video, I would like to give some information that in this document you may not find the scientific name in italics, so I am sorry for that. And second thing, watching this video on 1.25 or 1.5 speed will be effective. So let's start. Which of the following is a primary indicator of fish health? So the correct answer will be feeding behavior. First sign of disease outbreak in shrimp is usually reduced feeding. Which organ is commonly targeted by bacterial infection in fish? So it is gills. Good aquaculture practice recommends daily monitoring of water quality parameters. A major cause of disease in aquaculture is, so it will be all of the above, that is by overstocking, overfeeding and over-aeration, all leads to disease. The stress disease relationship in aquaculture is primarily due to suppressed immune response, which is a symptom of parasitic infection in fish. So the correct answer will be all three, that is pop eye, loss of color and erratic swimming. White spot disease in shrimp is caused by, so it is caused by virus. Lernia is a ectoparasitic copepod. Which method is best for early disease detection? So correct answer will be molecular diagnostic. Disease outbreaks are more common during, so it is more common during rainy season. In this question, some doubt is there between rainy season and winter, because I think that in winter the metabolism is slow and chances of stress is more, maybe, but rainy season is given here because as if we will suppose the culture environment like pond and all, water runoff takes place from different places, so pathogens can enter, so that can also be true. So you may check, but according to the answer it is rainy season. IMNV stands for, so it is infectious myonecrosis virus. Then horizontal transmission of pathogen means transmission, it is through water or contact. The external slime layer of fish helps in disease defense. Antibiotic resistance is often caused by, misuse of antibiotics. Aeromonas hydrophila causes, so it causes hemorrhagic septicemia. Which of the following is not a water quality parameter? So it is feed protein content. A fish showing flashing behavior is likely experiencing, so the correct answer will be parasitic irritation. WSSV, that is white spot syndrome virus affects, so it affects penid shrimp. One of the first step in disease management is, so it is accurate diagnosis. Epizootic ulcerative syndrome EUS is caused by fungus mainly. Common bacterial disease in fish with red source is, so it is furunculosis. Columnaris disease is caused by, so it is caused by Flabobacterium columnare. Causative agent of white spot syndrome virus is, it belongs to family Baculoviridae. Red discoloration of the tail in shrimp is often due to, so it is due to IMNV. Cotton wool like patches on skin indicate, so it indicates saprolagniasis. Ick, that is Ichthyopteris multifilus is a, so it is a ciliate protozoan. Infectious disease in aquaculture can be, so it can be all of the above, that is zoonotic, environmentally acquired and transferred via vectors. Vibriosis is commonly associated with, so it is associated with marine environment. Fungal spores can enter the fish body through, so it can enter through skin lacings. Which of the following is not a protozoan parasite? So it is Vibrio. Which virus affects mainly tilapia? So it is tilapia lake virus, that is TILV. Gill falling in shrimp is often caused by, algae and detritus. Necrosis in shrimp muscles can be a symptom of, myonecrosis virus. Which bacteria is commonly associated with shell disease in shrimp? So it is Vibrio. A symptom of EUS in fishes. So correct answer will be hemorrhagic ulcer. Amoebic gill disease is mostly seen in salmonids. Luminous bacteria in shrimp ponds are detected using light box test. Which of the following is not a symptom of disease in shrimp? So it is high molting frequency. Which virus is DNA based? So correct answer will be WSSV. In viral infection, antibiotics are ineffective. Argulis is a fish louse. Gill necrosis in shrimp can be caused by Vibrio species. A fish swimming in spiral pattern may be infected with nervous necrosis virus. A major carrier of disease between ponds is water birds. Which test is used to detect IMNV in shrimp? So it is RT-PCR. Bacteria that glow under dark condition are called bioluminescent bacteria. A common fungal pathogen in freshwater fish is Saprolegnia. Which parasite attaches to gills and feeds on blood? So it will be Dactylogyrus. Stress-induced disease in shrimp are usually associated with temperature fluctuation. Which gas is toxic to fish even at low concentration? So it is H2S. Ideal pH range for most aquaculture species is 6.5 to 8.5. Low dissolved oxygen primarily affects respiration. Ammonia in pond water primarily comes from fish excretion and decomposed feed. Nitrite toxicity in fish is referred to as brown blood disease. Which form of ammonia is toxic to fish? So it is unionized ammonia. Excess organic load in shrimp ponds can lead to stress and disease. A sudden drop in pH is known as pH shock. Alkalinity helps in buffering pH. Green water is usually due to the presence of phytoplankton. Excess blue-green algae in ponds can lead to ammonia buildup. Next is turbidity affects. So it affects all of the above, that is growth rate, vision in feeding and light penetration. Fluctuating water temperature causes increased stress and disease susceptibility. Bioflux technology helps to control nitrogenous waste. Sludge accumulation at pond bottom causes pathogen multiplication. Best time to monitor dissolved oxygen in pond is morning time. An indicator of deteriorating water quality is shrimp pond surface. Total ammonia nitrogen, that is TAN, includes NH3 and NH4 plus, that is ammonia and ammonium ion. Excess feeding leads to water pollution. Zero water exchange system rely on heavy aeration. A sudden drop in DO at night is due to plankton die off, bacterial respiration as well as no photosynthesis. Chlorine level above 0.1 ppm in water can kill fish. Water hardness refers to concentration of, it is due to calcium and magnesium. Prolonged exposure to poor water quality leads to chronic stress. Aeration helps to improve oxygen level. Which of the following is chemotherapeutic? So it will be formalin. Probiotics are used to improve gut health and immunity. Vaccines are most effective against bacterial diseases. The best way to prevent disease is by biosecurity. A biosecured hatchery ensures controlled entry and hygiene. Salt treatment is effective against ectoparasites. Quarantine is used to isolate sick or new stock. A balanced fish diet contributes to all of the above, that is immunity, disease resistance and growth. Which of the following is not a biosecurity measure? So it will be open drain channels. Routine pond disinfection is done by using lime or KMNO4. Disease surveillance involves regular sampling. Feed additives used to prevent disease include, so it includes all of the above, that is prebiotics, immunostimulants and acidifiers. For disease diagnosis, the most rapid method is PCR or RT-PCR. Integrated disease management includes, so it includes all, that is water control, feed quality and quarantine. Handling stress is reduced by, so it is reduced by gentle netting. Routine health check includes, so it includes all of the above, that is gill examination, water sampling and blood smear. Prophylactic treatment refers to, so it refers to preventive treatment. Overuse of antibiotics leads to, so it leads to resistance. Vaccines should be stored at 2 to 8 degrees Celsius. Sampling should be done regularly, weekly or bi-weekly. Use of gloves and boots during pond work is a part of, so it is a part of personal biosecurity. One Health concept includes, so it includes animal, human and environment. Zoonotic pathogen from fish includes, so it includes Vibrio vulnificus. Treatment without diagnosis leads to, so it leads to delay in response as well as economic loss. Shrimp pond biosecurity must be, so it should be practiced year round. So that was MCQ part. Now we will be dealing with some assertion reason type questions that are also most important for your exam. So first of all, this is the instruction that A option will be denoting assertion reason both are true and reason is the correct explanation of assertion. Then second will be both assertion reason are true but reason is not the correct explanation. C will be assertion is true and reason is false, and D will be assertion is false and reason is true. So let's start. White spot disease is one of the most devastating diseases in shrimp farming. The reason for that is white spot syndrome virus can rapidly cause mortality in shrimp. So it is correct, that is both assertion and reason are correct and reason is the correct explanation of assertion. Fish suffering from bacterial gill disease show labored breathing and reduced feeding, and bacterial infection leads to gill tissue damage, impairing oxygen exchange. So again both are true and reason is the correct explanation of assertion. Antibiotics are routinely used in aquaculture to promote growth. Long-term antibiotic use improves fish immunity. So it is assertion is true and reason is false. Biosecurity is essential for disease prevention in shrimp hatcheries. Biosecurity helps restrict the introduction and spread of pathogens. So correct answer is A, that is both are correct and reason is correct explanation of assertion. Aeromonas hydrophila cause hemorrhagic septicemia in fish. It is an opportunistic pathogen activated under stress or poor water quality. Again option will be A, both are correct and reason is correct explanation of assertion. Use of probiotics enhance the gut health of fish and shrimp. Probiotics directly kill viruses present in the hepatopancreas. So assertion is true but reason is false. Epizootic ulcerative syndrome affects freshwater and brackish water fish. The disease is caused by the oomycete Aphanomyces invadens. Again both are correct and reason is correct explanation of assertion. Myxobolus infection in fish mainly affects the kidneys. Myxobolus is a viral pathogen that attacks blood cell. So assertion is true and reason is false. Luminous vibriosis in shrimp cause high mortality during early culture. Vibrio harvey produces bioluminescence and releases endotoxin. So it is, that is luminous vibriosis is caused by Vibrio harvey itself. So it is a bioluminescent bacteria. So it is A, both are correct and reason is correct explanation of assertion. Stress increases the susceptibility of fish and shrimp to infection, and stress suppresses the immune system, reducing resistance to pathogen. Again both are correct and it is the correct explanation. Fish vaccine provide long lasting protection against bacterial disease. Vaccination helps to stimulate specific acquired immunity in fish. Both are correct. White fecus syndrome in shrimp is caused by protozoan parasite. It is commonly associated with enterocytozoan hepatopene infection. So again both are correct. Formalin is used to treat ectoparasitic infestation in fish. Formalin acts as an oxygen booster and fish stimulant. So assertion is true but reason is false. The gill is a common site of parasitic infestation in fish. The gill provides a moist oxygen rich environment favorable to parasite. Both are correct and it is the correct explanation. Bacterial disease in aquaculture are usually caused by gram-positive bacteria. Most pathogenic bacteria in water are gram-positive cocci. So it is D, that is assertion is false but reason is true. Routine monitoring of water quality is important for fish health. Poor water quality can act as stressor, predisposing fish to diseases. Both are correct and is the correct explanation. Infectious diseases can be transmitted vertically in broodstock management. Pathogen may be passed from brooders to larvae through eggs. Again, both are correct and is the correct explanation. Melanization is a common immune response in shrimp. It involves the deposition of melanin around pathogen by the prophenol oxidase system. Both is correct and is the correct explanation. Fish louse Argillus species cause parasitic infestation in shrimp. Argillus is a common crustacean parasite affecting crustacean. So, assertion is false, but reason is true. Last question. Histopathology is useful for diagnosing disease in fish and shrimp. It helps in identifying tissue damage and pathogen presence microscopically. So again it is A, that is both are correct and it is the correct explanation. So now we have come to the end of this video. So that's all about fish and shrimp health management. I hope you all would have find it interesting. So I will be back with another video related to course of fisheries science, MCQ only, because this exam are nearby only and we will be dealing with all the MCQs. So stay tuned for more such updates and keep sharing the video to all your fellow friends who are preparing for the exam. Thanks for watching.